Would you like to stand or sit?
Well, hello everyone. I am so happy to be here and to be part of this debate. First, I think we all want to make sure to send our thoughts and prayers to Elizabeth and John Edwards, and I'm very impressed by Elizabeth's strength and optimism, and I'm looking forward to seeing both Elizabeth and John on the campaign trail going forward. And I want to thank UNLV for hosting this. It's great to be here and to be in one of the early caucus states. And I want to thank CAP, the Center for American Progress, for all that CAP is doing to put health care on the agenda for America. And I especially want to thank SEIU. I want to thank you for not just talking about health care, but actually representing people who provide health care and take care of all of us across the country. I want to thank Andy Stern for being a leader, a visionary leader on this. And I especially want to thank all of my New York State 1199 SEIU members who I am proud to work with every single day. Now, you know, I feel a little bit like this is deja vu all over again. I mean, I worked with some of you all those years ago when we tried to convince the country and the Congress, we convinced the country, but we didn't convince the Congress, that we needed, for the sake of our country, to move toward and achieve universal health care coverage. Now, I am proud we tried. We may not have succeeded, but we set the groundwork in place so that now people are saying, boy, we wish we had done that back then, because costs have continued to increase. Pressures on the system, on our doctors, our nurses, our healthcare workers have just been so stressful. I meet nurses every day who tell me they're thinking of quitting the profession they love because they are having to work overtime. They now have 2 nurses covering where 4 or 5 used to cover. They're not being given the support they need, and each one of you could tell me a story like that. So what we need to do is to make a commitment. And I'm proud that everyone running on the Democratic side is committed to universal health care coverage. Now, we were only given 3 minutes, and some of you know I could talk 3 hours or 3 days about health care. But let me just briefly say, number one, I am in favor of universal health care coverage that brings in the 47 million who are uninsured, which is a disgrace in our country to have millions of people who are left out of the system. That begins to guarantee coverage to people who already have insurance. Because let's not kid ourselves, there are a lot of people who think they have insurance except when they need it. I met a woman in Austin, Texas last week who said, I'm a teacher, Senator. I make $38,000, and I have insurance through my employer, but last year I spent $19,000 out of my pocket, half of her income, because she had a pre-existing condition. So we can't get to universal health care coverage unless we end insurance discrimination once and for all. Now, I don't want to wait until I'm president to do that. I'm going to introduce legislation while I'm in the Senate to end insurance discrimination. Guaranteed coverage, no more cherry picking. You cannot eliminate people on the basis of pre-existing conditions because that's what we need insurance for. And, you know, we've now mapped the human genome. We're going to find out we're all susceptible to something. So none of us is going to be insurable if we don't change this system. And I think we need to start now in order to make some sense out of it and get people the coverage they deserve to have. We are also going to make better use of the money we've got in the system. We already spend more money than anybody in the world, and we don't get the best results because we have all these uninsured people and all these underinsured people, and many of you and people just like you all over our country who can't afford your deductibles and your co-pays, so you go without care, and then the problem gets worse. So we're going to improve quality, we're going to control costs, and we're going to, once and for all, have a health care system that is worthy of our country. Now, I know probably better than anybody how hard this will be. Yeah, I know. I've got the scars to show for it, and I've been through it. But that just makes me more determined, but it also makes me understand what we're up against. Because we've got to modernize and reform the way we deliver health care, but we have to change the way we finance health care. And that's going to mean taking money away from people who make out really well right now. So this is going to be a big political battle. What I'm doing in my campaign is talking about health care every chance I get, asking people for your ideas, your suggestions. I was listening to some of the questions that were asked. Great questions, deserve answers. We're going to have to deal with every single one of them. But if we don't have the support to get a bill through the Congress, we can keep talking about universal health care coverage, and the number of the uninsured and the underinsured will keep going up. And we'll keep spending more money, and we won't have very much to show for it. So we don't only need candidates to talk about it, and we don't just need candidates to have a plan. We're all going to have plans. That's not in doubt. We need a movement. We need people to make this the #1 voting issue in the 2008 election, to send a message to the Congress and the special interests. We're serious, and we're going to get it done this time. So as I said, Karen, I could keep talking, but I'm sure my time for the 3 minutes is up. So let me turn now to the questions.
Well, thanks a lot. Do you want to have a seat, or do you
I'll
want to stay?
stand here.
Okay,
Sure.
terrific.